universal health coverage. So I'll use the initial UHC. One of its main objectives is to support existing initiatives by governments to achieve universal health coverage. The second one is to increase awareness and understanding of the values of universal health coverage. The third one is to garner political and social support for universal health coverage. The fourth is to increase country-level advocacy on strengthening national health systems. And the final one is to encourage global players to allocate more funding for country-level universal health coverage reforms. Like the Jubilee Manifesto, when you look at the Code Manifesto, you find that they had commitments to health, but are they really fulfilling them? When we look at the Constitution, we have the right to health under Article 43. So it is a commitment first that the Kenyan people made in 2010 when they promulgated a new constitution, that health is a key issue that needs to be attended to. Then the final objective is to contribute towards improving the quality of actual media coverage in the work of universal health coverage and the Health for All campaign in Kenya. The outcomes of this orientation, we're looking at getting improved quality of actual media coverage on universal health coverage and Health for All. Then the second one is providing or getting information on the current bills, acts of parliament, and health policies which are being developed. Then we also need to look at how do we address the issues of consistent supply and availability of medical supplies without which universal health coverage is impractical. We've seen what has been happening with KEMSA in the past. So how do we ensure that KEMSA as a medical supplies agency will be able to cater to the needs of all Kenyans, whether at the national or devolved county, the county levels.
I'm an industrial relations officer with the Kenya National Union of Nurses, who are also partners with this organization. So where the nurses of Nyeri were struggling because of their less number in the ward to save a life of a mother who was dying, a mother who had been left to lay on bed and wait for her time to be assisted, started walking in the ward, and in the process, the child comes calling, and then the attention is focused on the nurse. Nobody looks at whether there was some stubbornness on the part of the patient, or whether there was underdeployment on the part of the nurses that rendered one person unattended to, and the other one in the process of trying to save another one. The media focuses so much on this incident of this child, but not the services these other people could have been given, especially under the given circumstances where we have infrastructural inadequacies or challenges. Now, when we go to the Kenyatta National Hospital incident, any one of us, somebody who has 80% burns, surely and men will actually support. Where do you get that direction? So as to think of it. But you see, people don't look at that. People look at she was raped because the media is saying. And that person is burnt to almost the complete body.
I think, let me be frank with the media. Media, you are the enemy of nurses. I'm a nurse. But when I hear anything about the media, I hate them. But I think today the attitude is going to change. Yes, we are hating you with passion because you are biased. You report when you are just favoring the patient, but you don't know the struggle that I'm going through. I'm sorry to say, with the investigations that have already been done about the Nyeri case, and you'll be shocked what will come out. Because there were 28 mothers on labor, there were 104 nurses on duty, I hear there were around 13 deliveries, and there were 4 admissions. You are 4 people. Even you are 1, 2, 3, 4. Can you handle this crowd alone? No, you can't. Please, embrace us. We are ready to embrace you because we know you are the people where I write. There are no crowds, there's nothing here, all them good that they do. Are we that bad? Why don't you want to appreciate nurses?
I think it's time for us to be bridges and get ourselves together in the same boat. We want to get it very clear that all journalists undergo the same training. There is no genuine reporter worthy that title, who can cover any story with partiality, unless otherwise. I'm not saying it doesn't happen, but I say anybody who is a genuine reporter and a genuine trained journalist can never cover a story with partiality. We are trained to be rather impartial. But when you cannot get the other side of the story, you are left to write on one side that you have gotten. And that's what my sister from Capital FM was trying to say. So please, as experts, as now we enter into this campaign and other issues that are coming up with the devolved governance, there will be so many issues and accountability and all that kind of stuff. You who are here, pass this message to your colleagues that when media people come in, they want to get both sides of the story. Because one side of the story is imbalanced, so it's not really an impartial story. But when it is not available, what does the journalist do?
It shall be possible to get Kenyans the healthy, the universal health coverage that we all aspire to get. And I think I also want to congratulate the MSH for this campaign, because we know this is one area that can easily be ignored. And what we are doing this morning, therefore, goes a long way towards delivering the vision for the health sector. Thank you very much. Thank you.
It's just that the dynamics around the right to health in Kenya just blame the health worker more as opposed to the government. Because for a community member, as long as they'll go to the health facility and not get the services they want, the health worker is the major problem. They don't get the area of the government could not have supplied medication, the government could not have allocated enough funding, or that the government did not disburse funding in time to buy the medication. So in light of that, HERAP is working to sensitize communities on the different players in the right to health and its realization, with the hope that they will be able to push the political officers, mostly because the political will is lacking, for realization of the right to health, especially with allocation of the human resources for health and budgetary allocation. Maybe the Nyeri case, maybe a political journalist did the story and ended up portraying the nurse and the hospital as the ones on the wrong, and maybe the mother who lost the baby had done something wrong. But I think it's still the role of the media to show the various aspects of the story, or the stories, the sides of the story. Like if you had gone and interviewed the medical superintendent of the hospital, I think you would give a different story now, stating the facts as have been stated by the two representatives from the Union of Nurses, as a different story than the one he gave last week. So I think the media has a very pivotal role to play in bringing out the two sides to the story, the governments and the service providers, and also of the person who accessed the health service itself. And then now from there we can judge the three sides of the story. Thank you.
If we have to succeed with universal health coverage, our governments, which the national and the county government must take charge. Let it not be a health worker issue. Let it be that any question, if there is no anti-malarial in that dispensary, can we have that county assembly member responding to that question? Why that happened? Not the health worker. So I'm happy that the story about the problems that health workers go through has been portrayed. Actually, it is bad. It is very, very bad. And this is an opportunity to partner with the media even more strongly, to give the stories that really matter, that make people make a decision. We don't want to hear that most of the money is being spent by our governments going for journeys and personal demands. We want the communities to see that this money belongs to us, and where should it be spent? It should be spent in taking care of my food security so that I'm not vulnerable to diseases. It should be taking care of my drugs in my dispensary.
Health for All campaign is a campaign that seeks to increase and expand access to treatment, ensure that people get health insurance, and the government is committed to ensure that it provides or honors its commitment. And that means that we want to ensure that alongside Vision 2030, we have a malaria-free Kenya. And by having a malaria-free Kenya means that we have mothers who are not infected in malaria, which means that they don't suffer from anemia, and that the children that they will give birth to are having worked with the media for close to 10 years, with all of you, I think I know every person in the media fraternity, you will come in hand in this campaign in the sense that you'll be able to bring out the messages that we want. And we want to see a powerful movement that revolves around focusing on health workers, infrastructure, and also targeting the different areas that we work together to ensure that we have comprehensive health care that is compassionate and affordable to health Kenyans. At the end of the day, all we want to make sure is that every mwananchi, like he says, Wanjiko and Nafuda, has access to treatment. So together I believe that we will have a strong voice, and the reason we all pulled together is to ensure that we speak in the same voice. So I'm looking forward to working with all of you and to sharing all the information that we have and building a very strong relationship, so that if you have questions that you need from us and any information that you may want from malaria or any of the different partners, you can feel free to call us.
Sometimes, again, the reporters, because of their problems of funding, most of the reporters and the journalists who work with the community radios are not trained at all. They train on the job. These are just journalists, people from the community who are interested in relaying certain information to the people, and they learn on radio production at the station. So they may not have so much education, they may not even understand about reporting on health. So again, maybe, Dora, you need to consider, like you had maybe the stories that were covered by a political journalist, although it does not matter whether political or not, nobody's supposed to be biased, you're supposed to get the facts. So it is good that maybe you involve reporters from various stations and media outlets for some sort of training, so that they may know how to go about enhancing and improving health care.
Universal health coverage, it's important for us to get it from a wider view as we talk about it, that what does it really entail, because it's good for us to understand it. And why I like the fact that the media is here is because, you know, with the media, good understanding of the media and how they disseminate the information that enhances the understanding of the citizenry, and at the same time holds the leaders accountable. So how does the media come in? It has to keep the conversation going with the people. That the people need to know, for example, a fact that out of the 210 billion shillings given to the counties, 65 billion is health. What does that mean? That's 30%. But how much is being allocated to health? Because health then deserves at least 30%. Because out of the 210, 65 came for health, and hence the same should go there. But now, what is happening? Because we don't hold them accountable, a large chunk of it is going to the entertainment allowances and a lot of other things, because we in the ministry, you can never dictate what the counties are doing currently. All you have to do is provide guidance.
The health fraternity fears the media so much because you go to some places and you are told, if you see the media people, never say anything because you're afraid of what they might go to say, the negative side of the story. But the media are there to help. We should be friends with the health fraternity, in that if you come like addressing a problem like Dr. was saying, you find out whether the problems that were encountered by the health providers was as a result of someone else who is not present at that particular time. What am I trying to say? Like if you come in a facility and I am the health provider and a baby has died in that place, the mother may not be able to say the right thing and say that it was my fault I brought this baby to the clinic at the last minute. They will always say, I brought my baby to, maybe for example, Kenyatta, and the nurses did not take action, so my baby died. So we should also try to find out from the community, from the health providers, from the people concerned, whether the health provider was provided with all the necessary equipment so that I can be able to deliver.
Kenya Red Cross is sit down with the county authorities and discuss some of these practical issues. And some of them are willing to look at their budgets and consider some of the key areas. We've also been able to bring in a core role of the pre-hospital care. And I know some of you have seen the ambulances being leased by some of the counties. But one thing we are looking at is trying to ensure that apart from them just getting ambulances, are they able to even train their healthcare workers in pre-hospital care? We know that this has been a huge gap in most of the areas in our country because people wait to get to the facility to be given assistance. But if we are able to give assistance even before getting to the facility, then you'll be able to cut down a number of the huge costs that we run into in the facilities. So we are looking at a multi-pronged approach, but our key area of focus is working with the county governments to ensure that they are able to take health as a priority. I think the role of the media has already been set. I don't need to overemphasize. I think as Red Cross we've enjoyed a lot of goodwill with the media, which we really are grateful about. And we are obviously taking advantage of this to roll even out this into this campaign. And I think one of the key roles of the media, as we already said, is let us make the public understand that health is their right. It's a basic right. They have to demand for the services and they have to ensure that they get the services. I think that is, for us, that is the basic thing. If somebody demands for a service, if 10, 20, everybody in the county demands for the health service, then the county government will listen. But as long as there is nobody demanding, people will take it for granted. So I think we need to look at the people themselves demanding for the service. Then the services will be provided. Then we also need to make health, as a major topic of discussion, the way our colleague has said. It should be the top item on the agenda.
And dealing with the HIV epidemic, we need to look at it as a human rights issue. And that is health in general. And with the provisions that we have, I think, from our constitution now, the community needs to be made to understand that health is a human rights issue. I think it's a human rights issue because it is your right, so you need access to information, you need access to the commodity, and you need access to the service. Ensuring that even these things that I'm hearing being talked about, the public perception to the healthcare workers and how we are scared. And I know many mothers deliver at home because we feel the healthcare worker is someone we really don't want to be with because they are mean, they slap us a lot. That's why we'll go to the Javolo, by the way. Yeah, so, and then it brings a lot of negative results for maternal and child health, but it is the role of the fourth estate, and I'm listening to this conversation and I'm glad that we had this meeting because then we begin to understand what our role is and the fact that we're having, science journalists here. It's your role to start to explain to us in the community why it is important for us to look at the healthcare worker not as an enemy or someone who slaps us around, but as someone who can be able to make better health outcomes for our life. We need to begin to look at universal health coverage as an accountability issue because it is not about what someone is giving me. We need the money. We are a rich country. I think we are. But we need to ensure the money is going to the right direction. If we want, to get to the Abuja Declaration, we need to stop, to cut stop the tap on corruption, and we need to ensure we have accountable leaders, in office. And that is my role as a citizen and everyone's role.
A third of all cancer cases is due to HIV and AIDS. And it seems that the shift now in reporting, in awareness and concern is going towards cancer. Many people are now worried about cancer than they are worried about HIV and AIDS. But this is something that we need to really report correctly, that HIV's cancers are more than the cancers that we have. Do you know that the salary of members of parliament per year is capable of providing Nairobians free water? Free water. That's the basic. You don't have to pay for water. And I liked what my sisters just said. This country has resources, has enough money to provide free water. And I've learned from the workshop where I've just come that main cause of death among children in Nairobi is diarrheal diseases. And they're preventable. How many of you have been to Muduru and market? The stage there. Honorable Gidai was able to flush out 2,000 rats. Now this food, where is it coming from? Do you know where it comes from? How? You've been to Kongwea, you've seen Kongwea. Why can't we just clean up where we are eating? No mother should die in this country of HIV days. No mother should die when delivering. No mother. There's no. How you are here? You are hearing that county governments have spent 127 million on excursions, and they don't have an ambulance. They don't have even a firefighter, but they have spent 127 million buying Prados. And we are lacking just specific things, even cotton. Just mother going to need, she's told to bring gloves, buy this for delivery. And how we have free delivery, the government. But not all mothers can access because they are very far, because of distance. And yet, the money that is being spent on buying Prados and trips is capable of equipping health centers, is capable of equipping our hospitals. So where are our priorities? I think you are the ones who are supposed to put these people on top of things and ensure that we do the right thing.
When it comes to reporting health, there's another challenge with journalists. I know they do good stories, but when they take the stories, where are the editors? The editors, maybe the story is not good, is not selling, then it will be thrown away. So again, we also need to check and have a talk with the editors. They need to help in this campaign. Thank you.
Many people on board because we realize health is a right that every Kenyan should have access to and should protect and ensure that they keep themselves healthy. So in terms of moving forward, those were the key messages we identified. And from here, we have some thematic subgroups that we are working with. There are those who attended the meeting last week. And the next thing we're doing is reporting results and managing the transition of this campaign. So we have those 3 key subgroups. And then the final bit is the technical input on countdown to 2015 and 2015 plus. These are the health-related millennium development goals. And we're looking at continuing with the aspect of universal health coverage and equitable access by all. So this is the 4th subgroup will be comprised of all the members of the other 3 subgroups. At this point, I'd like to say thank you to each one of you who has come to this meeting today.